Healthcare providers at all levels are still making efforts to eradicate some neglected tropical diseases in Gombe State, where some cases are still very prevalent. The state government says it is not relenting in addressing the challenges posed by these diseases in rural communities. Our rights correspondent, Awal Ibrahim, recently visited some of the rural communities in Gombe and filed in this report.
Neglected tropical diseases are said to be caused by a variety of pathogens, including bacteria, fungi, parasites, toxins, and viruses. Those that are prevalent in Gombe State include elephantiasis, lymphatic paralysis, and hydrocele. Early this year, the World Health Organization said in Nigeria, more than 1 million new cases of neglected tropical diseases are being detected, and more than 50 million people are at the risk of being infected annually. In these rural communities in Gombe State, Issa Bello and Tesala Seti are amongst those who have been suffering from elephantiasis.
It started with pains inside my bone, as if something is moving inside, and later my legs swelled up, and I started feeling feverish. For more than 15 years, I have been going to different hospitals, although I have stopped going to the hospital because I don't have much money.
This woman also narrates how she has been battling with the challenges of neglected tropical disease for years.
I
have visited the hospital and I'm using local medication as well, all in search of relief. I have been facing this ailment for as long as I can remember because it started when I was less than 10 years old.
This woman, who says she's 80 years old, said she contracted the illness when she was less than 10 years of age.
It started with swelling of my legs. Since I was younger, it will swell up and it will reduce on its own. There was no proper medication as at then.
But now it appears the right steps for proper medications are being taken. I met these patients at a medical facility waiting to be attended to.
The other one is not here. Okay.
Doris Daniel says she's now hopeful that her challenges will be over soon.
I was feeling feverish, then I went to the hospital and ended up being admitted. After the fever subsided, the next day I saw some swelling. I drew the attention of the doctor, who asked if I have ever reared cows, and I said yes. He referred me to another hospital in Gembu.
Rita Oguntiwimbu of Ame Healthcare and Empowerment Foundation has been assisting towards addressing challenges relating to neglected tropical diseases across Gombe State, as identified by the Federal Ministry of Health. She lists some of the most prevalent.
And it may interest you to note that the Federal Ministry of Health had mapped out most of the states of the Federation, and they've been able to identify the prevalent diseases, prevalent entities in each state. In Gombe State, we know that onchocerciasis, lymphatic filariasis, and schistosomiasis are the endemic entity diseases.
She has this advice for parents and caregivers as a preventive measures against neglected tropical diseases.
We want parents to continue to enjoy the free medicines that we distribute. The Federal Ministry of Health allocates medicine to partners, and with the support of the End Fund and the state government, we are able to distribute to every household for people from ages 5 and above.
At this event, the Gombe State Commissioner for Health says there is need for traditional leaders to continue assisting in identifying people who are facing challenges relating to neglected tropical diseases to be given free medications and counseling.
To also call on Your Royal Highnesses. I'm sure the people that are in the community, you know where those people with these disabilities are or challenges are. We will appreciate that you identify them and link them up to Amen Foundation.
But experts are still emphasizing that personal and environmental hygiene, as well as the availability of clean drinking water and constant hand washing, remains the most effective preventive measures against neglected tropical diseases. Awal Ibrahim, Arise News, Gombe.
Well, thank you, Awal Ibrahim, for that report. And joining us in the studio is Dr. Usman Abdulrahman. He is a specialist in infectious diseases. Thank you so much, Doctor, for being here. And I'm just looking at this report by the World Health Organization. It says that Nigeria, as it stands right now, we're still battling 14 out of the 20 tropical diseases that they listed. What would you say is responsible? Is it lack of adequate budgetary allocation or just misplaced priorities?
Yeah, it's a multifactorial issue. When you look at tropical neglected disease, the tropical neglected disease, from the name, you will know that these are diseases that are not being attended to. They are not getting enough. They are not getting enough. They are not getting enough response from the government or from the WHO and others. So if you look at it, definitely it's because they are still there because the attention needed is not being given to this specific type of diseases.
Is that why the name neglected tropical diseases, NTDs?
Yes.
But 16 out of about 14 out of 20 still prevalent in Nigeria. A lot of environmental factors, personal hygiene, lack of potable water. What are the other numerous causes of all the psoriasis and emphytiasis? You have all the...
Yes, most of them are actually due to poor sanitation, government not giving enough attention, because, for example, especially this filariasis is being caused by mosquito bite, not the one that causes malaria fever. You understand? But it's almost the same trend because they are found in where there is ponds, river, and ditches. So if you look at this that way, you know that our sanitation in the country is still very poor. We don't give enough attention to sanitation. And if you want to control this, why we are still having issues is because most of the control measures are still not being taken seriously. And one of the control measures is vector control, which is, if you want to break transmission, vector control is very key in infectious disease. Because what we mean by vector control is that these are the agents. Yeah.
Transmitting agents, so to speak.
Thank you. Transmitting agents. So if you need to break the infection, therefore, you need to break the transmission cycle.
Right. Well, 2 out of 3 Nigerians are at risk of tropical diseases, according to reports that we have garnered, and it got exacerbated in the last 2 years. Would you say COVID-19, yes, we know it was a challenge for the entire world. Here in Nigeria, we had some gains, but would you say that it has made things worse, especially in the provision of primary healthcare services at the grassroots where it's most needed?
I actually concur with you that COVID has actually worsened the health situation, health indices in this country. Because during COVID, many people did not have access to health facilities. So therefore, the issue of diagnosing what the problem was became more an issue because people are not going to hospital because during the COVID, there are a lot of issues during COVID. The health facilities, some of them are even closed in rural area. People don't get access to hospital. So if they are sick, where do they go to? Some of them end up going into traditional health facilities, which definitely some of them will even worsen the situation. So I would agree with you that COVID has actually caused more harm to some of these neglected tropical diseases in the last 2 years.
Well, majorly again, I think maybe you want to shed light on that. It's like there's a failure of the primary health system in Nigeria. maybe not what, blossomed in the 80s in the 80s and 90s during the period of late Professor Olukoye Ransom Kuti, who was an advocate of primary health instead of, the tertiary one. And there's a failure of governments here, that is local government, state governments, to provide just the simplest of amenities, water, potable drinking water, and the likes.
Yes, in the country, the local government system have been neglected to the lowest low. And you know that primary health care services and primary schools are usually under the care of the local government chair. So of course, if the funds is not going down to the local government, of course, the fund definitely will not go to primary health care at the same time, because the local government is not having funds to even maintain the office, then talk less of extending it to fund primary health care system. Of course, during Ransom Kuti those days give priority to primary health care, because that is the health facility that is very close to the community. That is the primary point of care for the community. But now, the government of nowadays, I may say that the attention is more on tertiary institutions. So that is why we are having increase in some of these diseases, more in rural areas, because primary health care, just like local government office, is being neglected. So primary health care, are also neglected. And this is where the rural populace goes to. Some of them don't even have access to tertiary or secondary health facilities.
Absolutely. So the primary healthcare facilities in the local communities have to be equipped enough
to
manage the situations. We'll have to say thank you so much. And of course, I do know that there's a roadmap really for primary healthcare for the next 10 years. Hopefully, we'll see some great improvement with that. But doctor, thank you for being here.
Thank you.
Thank you.